Why would we make all these changes for like 1 to 2% of the population? This is a common question I get when I talk about becoming more gender inclusive as a practice of using gender inclusive language. Why would we do this for such a small percentage? And I'm so glad people ask that question because it gives me the opportunity to recognize that it needs to be answered. For those that have asked me that question, you are definitely not alone. So here is the answer to that question. I think there are 3 main reasons, and I'm gonna approach this in medicine because that's who I'm usually talking to, or physicians, but anyone that wants to listen. There are 3 main reasons why I think it's worth doing it, worth being gender inclusive. The first one I think is best explained through an analogy. So, we all benefit from elevators. The elevator was created for people who can't navigate the stairs. They were not created for myself and many others who can navigate the stairs, yet we all benefit from the elevator being put in place to make other levels of a building accessible to those that could not navigate stairs. And so that's what I have to offer about gender inclusive language. It benefits way more than the 1 to 2%. Because with gender inclusive language, not only are we not assuming how somebody identifies, we're not assuming we know based on how they look, we're not assuming what their anatomy is based on their biological sex, we're not assuming how their body works, we're not assuming who they love. That's all part of gender inclusive language. So let me break that down a little bit more. I think about how I would love people have to been more aware of gender inclusive language when I was growing up. I had what was back then in the 70s and 80s known as the Dorothy Hamill haircut. If you don't know who that is, she was an Olympic ice skater, but needless to say, she had short hair. Those of my generation will know exactly what I'm talking about because I'm not the only one that got the Dorothy Hamill haircut. Regardless, it was a short haircut. And so I often was referred to as a boy. And I often joke that the first complete sentence I ever spoke was, I am not a boy, I'm a girl. I got confused as a boy so often because of the way that I look. I would have loved people not to make that assumption just because of my short hair. And I'm not the only one. There are many times that people are often confused whether it's a man that has long hair, whether it's based on how people dress or any number of things. Not just the transgender, non binary community. There are people outside the community that often get mistaken, and it doesn't feel good. It's not that people don't understand when they're mistaken, but it doesn't feel good to repeatedly be misgendered, to repeatedly be called a different thing because of how people perceive you, that they can't see you for who you are. And you can say, well, you should dress differently, groom yourself differently, whatever that is. But people dress and groom themselves the way they do for their own reasons. Let's be honest, it's all made up anyway. I've talked about this in past episodes how what's considered, quote, masculine, what's considered, quote, feminine has changed drastically throughout the years. So people tend to dress and groom themselves of what feels good to them, and they see themselves as who they are. So when those assumptions are made, it doesn't feel good. So when we stop making assumptions, when we become more gender inclusive in our language, we often help those individuals as well. One of the other things I mentioned is assuming who people love. So by using gender inclusive language, which many providers do anyway, but it benefits other people by asking about somebody's partner or their spouse, not assuming who somebody loves or how their partner may identify, also helps more people than the transgender or non binary community. Making assumptions on bodies, that gets eliminated too. I'll give you a great example. I remember hearing about a very upset patient that had come from the ER. Please forgive me, my ER colleagues, but this is what happened. They went in with some sort of lower abdominal pain, and the physician at some point questioned whether it could be an issue with that patient's ovary. The patient had had a hysterectomy that included removing the ovaries. So the patient didn't have any ovaries. And right away, affected the trust between that physician and the patient. And I'm guessing what happened there was the physician did not have time with, I'm guessing, a very full ER to look through the patient's history, hadn't had a chance to take past surgical history, had just given some preliminary thoughts looking at the patient's biological sex, what was in the chart, seeing female and assuming what was there. And so, this is what I mean by getting rid of those assumptions, by being more gender inclusive, by thinking of things in a broader sense. It helps all patients. It also helps patients that not only have things surgically removed, some people are born without certain anatomy. There are patients who are intersex, meaning that they don't fall into either the classifications we use as male or female for a variety of reasons. And one of the reasons may be they have anatomical differences, maybe on the inside, maybe on the outside, maybe both, etc. And so some of these patients may be born without certain aspects of the anatomy you might assume that they have. Some people are born with more anatomy than you would assume they have. So there's a whole variety of things that when we stop making assumptions, we begin to be able to provide better care to the patients by finding out rather than making those assumptions, jumping to conclusions, and sometimes ruining that patient provider relationship. The other place where using inclusive language helps is what I often talk about when teaching sex ed, and that is not using absolute language. The comment that women have babies, that's very absolute language, and not everyone who identifies as a woman can have a baby, regardless of their anatomy. I saw so much pain from people that suffered from infertility. It doesn't mean they wouldn't suffer if we had been more inclusive in our language. However, I do think it educates people to the diversity of possibilities that is natural in biology. So, assuming what people's physiology is based on their biological sex can be problematic. So, again, by learning to be gender inclusive, by learning to use inclusive language, by not assuming not only people's identity, but their biological characteristics, their functioning. It helps us provide better care. It helps us see the patient as an individual. So many times we're in a hurry, understandably, and we're trying to take as many shortcuts as we can and still provide the best care. This helps us to slow that down and realize we cannot do that. And we can provide better care when we know. And on top of that, I hear from many providers that I've worked with that I talk about being more inclusive and noticing assumptions, noticing the biases, noticing where we might jump to conclusions. They tell me that they begin to pick up on where else they might be making assumptions. Things from assuming patients of a certain age have children or even grandchildren, assuming that patients of a certain age want children, assuming that all patients were raised by their parents. There's a lot of assumptions that people tend to make. And when we begin to recognize where are we making these assumptions, we can provide better care to all patients. So I don't see using gender inclusive language helping a small percentage. I see it helping all of our patients by beginning to recognize where we make assumptions, by beginning to let the patient and the history give us the information we need rather than making those assumptions based on what the chart says their biological sex is. The other reason I think that we, quote, make changes for 1% to 2% is that's what we do as physicians. We do that all the time. We are trained not just to see the general common things, we are able to see the majority, but we are also trained to know what those rare things are in medicine. We are trained to see the zebras. And so, for those of you that are not in medicine, we often refer to things as zebras if they're very rare. So, we are trained to see the small percentages. We are accustomed to considering not just the large percentages, the most common things, but also considering the one percentage. And for that reason, we look at each patient as an individual. We don't treat people as the majority cases. We treat every patient as an individual. Why would we not include their identity in that? The last thing I will say is that most of us go into medicine with a real desire to help people. And so part of helping people is seeing them, allowing them to be seen and respecting them, treating patients with respect. Now, the comment I often get is like, well, patients shouldn't get angry if we misgender them. Like, they should understand we're trying. We didn't mean anything. It shouldn't be taken as a villain or anything like that. But here's the thing, even when a patient doesn't get upset, even when a patient is completely understanding, is forgiving, is completely fine, many times we still don't feel good. We still feel really badly about doing. And so I would offer that it is a part of who most of us are, that we desire to treat patients with respect. We desire to have connections with our patients and being able to see them for who they are. Provide the education, provide the relief from whatever brings them in to see us. And part of doing that is seeing them and not making assumptions and respecting their identity, even if it's 1 to 2%. So, when I am asked, why make so many changes for such a small percentage? The answer is way more people than that benefit. The second answer is that is what we do as physicians. We look at people as individuals. And the third thing is we desire to treat people with respect. It's a strong desire for that. And this is such an easy way to change language to be more inclusive. It's everyday language. It's just creating those new habits and those new routines. So instead of saying why, say, please be inclusive for that 1 to 2% because I'm going to benefit, my family's going to benefit, everybody's going to benefit. Because inclusivity matters.